Coming up next.
Surrogacy is, in simple terms, that a couple, legally or known couple or partners, the man donates his sperm, and the carrier of the pregnancy is just housing a baby, but it's not hers. So a man donates a sperm, and a woman's egg is used to cross-match to have a baby. The food, the nutrients, everything the baby takes comes from the woman through the placenta. So there will be exchange of blood. But genetically, will there be a DNA of that woman? Very unlikely, because the baby has already been formed from outside. There will eventually be a transfer of the woman's blood to that baby through the placenta. So you do a lot of viral screening, like HIV, hepatitis, and all, to make sure that the carrier is healthy enough not to infect the baby that is being housed in her womb. Any genetic disease, from, let's say, diabetes, hypertension, and all that, can be expressed from the owners of the spermatozoon and the egg. But blood transmissible infections can be transmitted to the baby from the carrier of the baby. Or any autoimmune condition where the body is fighting off even sperm. The woman is not able to keep a baby in that womb. There will now be an indication for another person with her egg and the partner's sperm. Now, the woman's egg and the man's sperm is cross-matched in a test tube. That is why it is in vitro fertilization. In vitro means outside. In vivo means inside. Thank God for BBL, where people can get back their snatch back, but can snatch back their body from. But there are women that, if they are not inclined to that, they may lose that figure 8 that you saw when you were chasing them. There are women that have run mad, what we call postpartum depression, from poor social support from their partners. My name is Dr. Sam Obo. I dey run practice for Lagos, where a lot of consultants, they come, specialists, they come, they see patients with me, and we attend to the health needs of our patient. Person wey sick, wey wan make the best of hands for in location, for either Ikeja or Lekki Phase 1, Aja, Ikota, Thomas Estate, may you see am, he go call us. For consultants, you book ahead of time. For emergencies, we can attend to it across all locations 24/7. So we dey the health matter, we dey open human body, they operate, they close and back, and they go home alive and well. People wey sick call us, they can even speak to us on phone. We offer consults. Even our consultants can attend to people anywhere in the world. All you need to do is to go to the website and book through Google Meet, and you speak to the consultant. Now, what will they do with that, though?
Okay, this one not sweet you, but marrying plenty wives sweet you.
I just wish men can carry babies.
If
they can, we'll have less babies.
It's the OUTLOUD podcast show.
Yes, good day everybody, and welcome to this session and episode of the OUTLOUD podcast. And I'm your host. My name is B5. I have lots of wonderful people in here. I have lots of wonderful people in the studio today. There's a face you've been seeing, and there's a new face, an amazing person, and he's a guest. Based on the topic we're discussing today, he's going to break it down for you. And note, we always told you that it's not just going to be about celebrity gist and all of these topic making headlines. We're still going to educate you and make sure you know things about life that you don't know. Welcome to today's episode, and I have by my immediate left Tracy.
Hi guys.
And my far left, I have a face you've always been seeing, you've always been seeing, Luchi Green.
Yo, hello guys, how you all doing today?
Before I introduce our guest, I want to tell us a short story. So I have this friend, and she's been married for quite some time, and she gets pregnant, and has miscarriage under 3 months. She gets pregnant, miscarriage in 3 months. And this has happened for a couple of times. And she reached out to her husband and said, Chairman, let's try and do surrogacy. Well, since this thing is not staying around me, let's get someone to carry this baby for us. And the chairman says, no, I want it the native way, where you have to be the one carrying our baby. And she goes on like, okay, no problem. Since you want it like that, I'm down. I don't care how much or how many times the baby comes and goes. But the day you carry another person come meet me, say he carry belly for you, me will get problem. You must say, no worry, we'll just try to go, So fast forward, one day the man came and said, I'm sorry, someone is pregnant for me. And someone was pregnant for me, and she just had the baby. And that was where the turmoil in the house started. Introducing Dr. Sam Og.
Welcome.
All right, guys, good to have you here. It's a pleasure to be on this platform to talk about our discussion today on this podcast.
And with that being said, I would want, our topic today is, the lady said to the husband, let's do surrogacy. And the husband says no. But first of all, before we dive into the discussion, I will want Dr. Sam to introduce himself properly. Dr. Sam, please tell us about yourself and your practice.
All right, thank you. My name is Dr. Sam Obo. I'm the founding partner and the medical director of a multi-specialty group called Smart Health Life Care Group. You can actually check out what we do on our website, www.smarthealthlifecaregroup.com. Apparently, we run a multi-specialty practice where we call in, we have a lot of enrolled consultants, obs and gynae, fertility specialists, dermatologists, general surgeon, urology, orthopedics, and all specialties, including cardiology, rheumatology, and all. And we serve the health needs of these patients across 5 locations in Lagos: Ikeja, Lekki Phase 1, Aja, Abijo, and Thomas Estate. And we've been doing this for the past 5 to 6 years with lots of testimonies in our practice. So that's about what we do. I trained at the University of Ibadan, and I've been practicing for the past 10 years, 10 to 11 years actually. Thank you.
Dr. Sam, all of, I'm glad you introduced yourself, and everybody that's watching would kind of know what you said. But for that market woman that is in Balogun Market or Aja Market selling pepper, onions, you know what's how you talk. Please, can you break it down in a layman's language?
Okay.
The market
My name is Dr. Sam Obo. I dey run practice for Lagos, where a lot of consultants they come, specialists they come, they see patients with me, and we attend to the health needs of our patient. Person wey sick, we want make the best of hands for in location for either Ikeja or Lekki Phase 1, Aja, Ikota, Thomas Estate. May see am, he go call us. For consultants, you book ahead of time. For emergencies, we can attend to it across all locations 24/7. So we did the health matter. We dey open human body, they operate, they close and back, and they go home alive and well. People wey sick call us. They can even speak to us on phone. We offer consults. Even our consultants can attend to people anywhere in the world. All you need to do is to go to the website and book through Google Meet, and you speak to the consultant. Now, what will they do with that, though?
I beg, just for the sake of people who really want to get to you, tell them the website first.
Okay, the website now, www.smarthealthlifecaregroup.com. www.smarthealthlifecaregroup.com. they can book us, and our facilities are all registered with Lagos State Government. Thank you.
All right. With that much being said, and the topic we're dealing with today is complicated. It's not something we know in Nigeria. It's not like we don't know it, but not like much people know it. Dr. Sam is here to help us break it down. From the story we told earlier, I want to ask Dr. Sam. Surrogacy, we know that some countries it is almost illegal. And some other countries it is legal, but the surrogate mother must not take a penny.
Oh, sorry, Brett. Sorry. Before we go into what is legal, what's not legal, can you define what surrogacy is for us?
All right.
Yeah.
So it's a pleasure to discuss surrogacy, the needs of surrogacy in some families. That's about what the earlier story about. So today we are focusing on a couple that had been trying to have a baby, and there had been a recurrent history of miscarriage from the woman. Those pregnancies do not stay more than 3 to 4 months, as I understand. And this has happened serially in their marriage. And over time, the woman says, oh, can we even have a surrogate since my condition does not allow me to carry this baby to term? And the husband says, oh, would rather go the traditional way to have this baby. And eventually the man go play outside match and now has a baby. So the topic is, was there really a need for surrogacy in that family? So that now brings us to know what is really surrogacy. So surrogacy is, in simple terms, that a couple, legally or known couple or partners, the man donates his sperm, and the carrier of the pregnancy is just housing a baby, but it's not hers. So a man donates a sperm, and a woman's egg is used to cross-match to have a baby. Now, this baby, because of the health concerns or special needs of the genetic mother of the egg, is not able to carry it in her own womb. So another person is now carrying the fertilized, so the baby formed from a couple. So what is clear is that a surrogate mother is carrying a baby that is not biologically hers. So surrogacy means that a woman is carrying a baby in her womb that is not genetically her baby. It means that the woman is not the one who has the egg for which a sperm fertilized and a baby was formed.
I know in some countries, around Europe, it's illegal. Surrogacy is illegal. And in the UK, it's legal, but the surrogate mother must not take a dime. Oh, okay, it's penny and
Not
shillings.
being monetized.
Shillings, I think. They will not take a shilling from whoever she's getting the baby for. So what is the legal
Consideration in
Nigeria?
Okay. So ethically in Nigeria, the current happenstances in Nigeria does not explicitly say that surrogacy is illegal. So it is allowed. However, it is important to state that as of today, there is no legal framework to guide the operation of surrogacy in Nigeria. So this is a call for attention that our National Assembly, the NMA, should actually think of something about surrogacy, because in clear terms, surrogacy has been happening even before technology in eastern Nigeria, where there is a lot of patriarchy and there is a transfer of generation through male. So we'll get to that, but the point is, this has been helping some families, and the earlier we have a legal framework, the better that people have a template legally to work with.
Okay. So is surrogacy like a frequent thing that happens in Nigeria and other parts of the world?
So let's focus on Nigeria. For us in Nigeria, up until last year, surrogacy was not something that a lot of people shy away or talk about in very low tones. But we know about the sensational occurrences lately about celebrities who had come out to say, oh, they had these challenges. We know of a Nollywood actress who had a serial miscarriage that even caused the failure of her index marriage then. And of course, when that marriage broke down, and she told herself, oh, I'm not the one that created myself, and I have a condition where I cannot carry a baby. And she sought surrogacy, and the baby is growing, and we all know. And last year, we knew of a celebrity that also came online to say, oh, I had this baby through surrogacy, and there had been talks about this left, right, and center. So it's something that we must not shy away from. It happens in our day-to-day Nigeria.
Okay, so like, how beneficial is it to the lady who is carrying the child for the couple, or the person who's carrying the child?
Okay, so for the lady that is carrying, first of all, there are assessments that are done to know that the woman is healthy enough and fit enough to carry a baby, right? From doing an imaging to look at the womb to doing serial viral screening, because there would eventually be a transfer of the woman's blood to that baby through the placenta. So you do a lot of viral screening like HIV, hepatitis, and all to make sure that the carrier is healthy enough not to infect the baby that is being housed in her womb. Do you understand? So the woman, and most times we encourage young women of between maybe 21 to 30. That's for agencies that do it. Now, it is clear that there is no doctor, including me, that runs a surrogate agency. We hear that a couple have a concern as to difficulty with carrying a baby to term, and they provide someone in facilities where it is allowed, ethical in those facilities, and it becomes the carrier. Whatever legal framework, legal contracts, agency agreements that are done, the doctors are not directly involved. Our job in assisted reproductive technology is to give a couple a child. If it is found through our investigations that the woman cannot carry the baby, then now becomes a medical indication for a surrogate.
Okay.
So
if there are
agents, is it to the lady who is carrying the baby? Like, is there
I'm
like
not
monetary
exactly
value,
sure.
or
I'm not exactly sure that there is any benefit.
Because if women are like interested to do surrogacy, to carry a child for someone else this frequently, then that means there should be like some sort of either monetary benefit or
I'm
something.
not sure it's in his place to advise.
So
Okay.
it is not ethical in medicine that a woman is being approached to carry a baby, to change the contour of her look, to go through the mental and emotional turmoil of carrying a baby that eventually will not be hers, right? However, a woman can do it for charity. A woman can do it to support a family. In cases where the couple feel they should be able to discuss, it is a private thing. It is not in our scope as doctors to be involved in what happens behind closed doors. Our job is that a couple is suffering from subfertility. We don't call it infertility anymore. And there is no baby, and there is a means to a baby, and they provide a carrier, and the baby carries the baby. So whatever happens, whether it's a surrogate, whether there's an agreement, the lawyers and the surrogate agencies run it. Okay. But for us, it is to make sure that a baby is conceived and transferred safely to the carrier. Thank you.
Does the carrier's DNA is it transferred to the child?
So, in clear terms, no.
Okay.
Because a baby is formed from a spermatozoon fertilizing an egg, and a zygote is formed, right? So prior to transfer of the baby to the woman, it would have become an embryo. So when the sperm meets the woman's egg, it forms a zygote. After 48 hours, going to the third day, it becomes an embryo. Mm-hmm. Transfer of the baby, which is at the embryo phase, happens from day 4 to day 10, depending on the guideline of the facility. So at the point of transfer, is already a genetic child from other sources for which the woman is now housing. However, what happens is that if the woman, the carrier, the surrogate mother, has a lot of some infections that are viral, because there will be an exchange of, we prepare the surrogate mother with some injections, hormonal injections and all that, to help her get into the phase of being a woman that would carry a baby. Right? So when the baby is there in the womb, of course, there will be a placenta, and the placenta is like the connecting dot, the connecting tissue or organ, or connecting tissue of the baby in the womb and the woman's body. The food, the nutrients, everything the baby takes comes from the woman through the placenta. So there will be exchange of blood. But genetically, will there be a DNA of that woman? Very unlikely, because the baby has already been formed from outside before transfer to.
Okay, doctor, let me ask a question. So you had mentioned that the story that he had mentioned, which is the crux of all of this discussion, is
Okay.
surrogacy would not have been your first option for the couple. That's what he had said, that you're not sure that surrogacy would have been the solution for them.
No, that's not. Maybe I meant it in another way. So
Okay.
if there are indications for surrogacy, and top on the list is that there are medical conditions, including recurrent miscarriage of more than 3 to 4 times, that a woman is not able to carry pregnancy to term. So the indication, if we had examined that woman and the woman had gone through all the gynecological advanced tests, including checking if there is a cervical incompetence, the tip of the womb is called the cervix that connects the womb to the vagina. So if that cervix is incompetent to carry a baby, maybe it's open from a poorly done dilatation and curettage, that's evacuation and all that, or any even a genetic make of the woman that the tip of the womb is not closed, the baby will not stay. So what we do initially is we do sacklage. We do a procedure called sacklage to close the tip of that womb. After the baby is 13 weeks in the womb, and we are sure that it's a healthy baby that will stay, then we do a sacklage, and around the time of 36 to 37 weeks, we remove the sacklage and the baby is delivered. Right? So, in clear terms, if there is a recurrent history of miscarriage in that woman, is an indication for surrogacy.
Okay.
There are other things, a medical condition in the woman, like autoimmune conditions. I know of a woman who had relocated from UK to Nigeria who had rheumatoid arthritis. So it's an autoimmune condition, or maybe they even have what we call systemic lupus erythematosus. We call it erythematosus, that's SLE, or any autoimmune condition where the body is fighting off even sperm. The woman is not able to keep a baby in that womb. There will now be an indication for another person with her egg and the partner's sperm fertilized outside, which is the IVF, and is now transferred into a carrier, which is a surrogate mother.
Okay, now you've seen all of this play out. I know you've had families where things, lots of this play out. So if a man says no to surrogacy and goes ahead and impregnates house help, friend, do you think it's the man's fault, or he's at liberty to do what he feels is right for him?
I think the women should answer
Okay,
first.
so let me come in. Unfortunately, we're in Africa, right? There are some things that are applicable here that are not applicable abroad.
Hey,
I would say that
this sound is
the
not
one that
nice.
he goes on to impregnate the house help. So on the basis that they have an agreement that she gives the baby to him. I think that's what we'll call the traditional surrogacy. But I don't think that was the intention. He just stepped out of his marriage, right? And I think then there's this saying that we fear what we don't know. So we are not aware of surrogacy as much. So a lot of African men don't understand that it's still your baby at the end of the day. But the notion is if another woman is carrying my child, it means that it's not my wife and I's child.
But in this instance, it was now an outsider that carried that baby, and it's not even the wife's egg.
Yes, so they rather do it themselves than have like it being done medically. That's what I'm saying. At the end of the day, because we have no knowledge of it yet. That's what I feel.
So what do you think, Luchi?
About
What Bright is talking about?
from another lady.
Yeah.
First of all, I think it's wrong. A man should have self-control. First of all, yes, and then maybe if any case
where you
that
from?
I'm from Imo State.
Imo State. Nwoke namro nwoke. The wife is giving birth to a baby girl as a regular, and he has no male to represent his empire. And you are telling him to stick to the norm because he has a wife that is giving birth to girls.
Are you justifying
Okay,
it?
so let me. Okay, this is reality right now. This is reality. I know some Igbo men.
Are you trying to set me
Some
up?
Igbo men will be like, I don't want my generation, my lineage to close, and all those kind of things. Let me tell you something.
It's not just the Igbo men.
Okay,
Let's say
African men.
Nigeria.
Okay, Nigerian African men.
Nigerian men.
Okay, Nigerian men. They don't want their lineage to close.
The lineage is far much more important than whatever he has.
Okay, fine.
There's this man that
think
says, let me try and put together how he said it. Success without successor is a waste.
Okay, fine. In that particular case, there are always different sides to different approach.
And you know when a man says successor, you know what he means.
I understand what you mean.
Okay.
I'm Igbo.
Okay.
See, some women, they might still reason with their husbands and be like, okay, I understand where you're coming from. I know you need a child. I know you need someone to carry on your family name and all those kind of things. Okay. Some women will even say, okay, I will bring the lady that will help out in this situation. But that's like a discussion that a family has.
All right. So I think that
understand?
answers it. So, firstly, we are now in 21st century. We are not in the century of our fathers where women don't have voices. I think it is very uncharitable that a man goes beyond an agreement with a partner, legally bound partner, to have a child outside. It's a no-brainer, right? Mm-hmm. So what should have happened? I think the man should have... So they had a discussion.
Please, hold up.
No, this is not even just being moral. I feel that a man may end up creating enmity between the children when...
Hold up a minute.
Okay.
Some people may not like this, but I tell you, I'm an African.
Okay. So we can balance you being an African and being fair to a woman.
Hold on, Dr. Sam. A Nigerian, to be precise.
Okay.
I'm a Delta.
Okay.
What does that mean?
Leaning towards the Igbo tradition.
Yeah.
So all of this I was saying, I say this in different places, and it might not suit the ears that are hearing it, but it still does not change the fact that this is Africa, this is Nigeria, and things have been done in a certain way.
Okay, like
so let's make something very clear.
Okay. Hold on, let me say this. In the Igbo tradition, right, a man is entitled to as many wives as he can control.
If he did not go the white man's way. If he did not go the white man's way.
Provide. It's not control. It's provide. It's provide. It's not control.
Like you said,
it is provide. If you can provide.
You said previously you are from the Igbo state.
Yes, not control.
So the thing is this.
Provide.
So the thing is
this. As much
this.
as you can provide.
Yeah.
So which is to say, if I'm a billionaire and I can afford to provide for 500 wives, I can have 500 wives and none of them should complain.
What happens when you leave?
That's not true.
What happens when
That
you
is
leave?
not true. Even
No,
in
you
the
need to
Igbo culture,
answer.
even in the
You need
Igbo
to
culture,
answer.
even in the Igbo culture, no, that's not true. Even in the Igbo culture, they will advise you to marry one woman because in the Igbo culture, we don't even really do polygamy like that. The only reason anymore, the only reason why we do polygamy then was probably because of famine and all these other things.
You said as he can
Provide. No, I was trying to correct you. You said control. I said it's not control.
So, Bright,
Provide.
what is clear? Bright, what is clear is, let's stay on the issue of the first question. So, a couple had an agreement that the woman had opted to say, "Sir, my darling husband, I have a condition where I'm having a recurring miscarriage. Technology, medical advancement now provides that we can't get a surrogate even in Nigeria." And the man says no, he would rather go the traditional way. And I'm hoping that he meant the traditional way with his wife. So first of all, he broke the trust of agreement. And to be very clear, I think when couples agree on issues and discuss it, if they had gotten to a point where they had stayed 5 years, 7 years, the woman is getting older, they can bring it back to the table. And the woman, even Sarah allowed the house help to give Abraham a child. But that was hold on.
You should get the
So the
context.
So the context is this.
Not be Guy Manson.
There was a breach of trust, and most times the men pay dearly for it. There was a breach of trust. This is a woman that cooks for you. This is a woman that would take. That is the woman you trust. That's the woman you would trust to even raise that child. The lady that probably had a child for you outside may be a woman of easy virtue, right? Would you rather want that as your own daughter? So these are the issues. It is not just about being moral. And I'm not a pastor. But the thing is that if you are going beyond the bounds of having a child outside the agreement you've had with your partner, it should be discussed. And there are provisions. There are women that can agree to provide a woman you do not know. Maybe they trust her. They trust each other. It may not work. Now, to answer the next question about the number of children, my grandfather had 13 wives. Right? And I understand that when my father was alive, he had up to 50-something children. But that was a home of toxicity, competition, fighting, and I would never... In fact, while my father was alive, he told me that if there must be a reason for me to have another wife, I should make sure that the first one is no longer with me or we don't live in the same house. It shortens a man's life by more than 10 to 20 years. Because you keep settling issues, there is no peace. It is even better you have 3 than 2. But that is not the point. That is not the. But that is not the point of discussion. The point of discussion is that should there have been a discussion on surrogacy for that couple? Yes. They were meant to discuss surrogacy. They were meant to see a gynecologist who would discuss in clear terms for the man to understand that the baby that is gotten through surrogacy is still his sperm. And it's still the wife's egg. True. But it's just that another person is housing it. As of today, I know more than 15 couples who peace came to their home because they were able to have a surrogate child. And there's a cry of a baby in that house. So it brought peace to that home, it brought stability. And to a large extent, the man is enjoying his wife without any family planning because they bang well. And you know that they say that any home where the bed is always shaking, there's peace in that house.
One thing the surrogate man choose to lose.
Lighter notes.
Can I speak?
Okay.
So polygamy is accepted when it's traditionally done. Then if you are legally married to one woman and you marry somebody else, that's bigamy, and that's a crime. So it's not a guy, man. You can't.
So,
you
yeah.
can be in jail for that.
Yeah.
So just to add to what my sister said, that was why when you were saying that a man can marry
You were
as
shaking
much as
hands.
possible, I told us that if
You're
a,
shaking
my
hands.
guy, my
Your
guy.
guy.
so the thing is,
Hey,
if
God.
a man marries traditionally without going to the courts, which is a white man's tradition of doing a court
Dr.
marriage,
Sam, shake me
or
again.
doing
A white
doing-
man, a white man culture.
or doing a white wedding,
Are we
of
white
which
people?
now they even bring in the legal document for you to sign to legalize that. If a man does that, then it becomes a crime for him to go out and have a child. But if it is just the traditional rights in an African setting, our culture recognizes polygamy. But that is not a topic of discussion.
Yeah.
We presume that this couple that is in question actually got legally married.
They don't even live in. They don't live in Nigeria. They live in the UK.
They live in the UK. So our discussion will be on global precept that at that instance there was a breach of trust in
Yeah.
that
Yes.
union.
So on a lighter note, what if the surrogate mother decides not to give up the child
Like,
anymore
zoot with the
and
baby.
run away with the child?
There's nothing on lighter note about it.
There's nothing.
Okay.
There's nothing lighter note about it. So that is why we encourage
There are
that
no regulatives.
there should be a legal agreement signed by the donor baby, the people that are donating the baby for the woman to be a carrier. So the donor embryo, right? So the couple is meant to have an agreement with the surrogate. In systems where things work well, there's meant to be a legal framework of we are approaching you for this, and this is our agreement,
Terms of
and they meet a
engagement.
lawyer, and there are terms agreed. What we do is that we do not allow the woman who delivered that child to be with the baby for more than 15 minutes after birth. Must not breastfeed, must not baby warm. So what most facilities do is that at the point of delivery, the woman does not even see the baby's face. The baby is carried by the pediatrician, the midwife, to cleaning, and from there you disengage the surrogate mother from the surrogate baby.
Okay. Sorry, doctor. Can I ask a question? So we have the carrier. Carrier is let's say
The surrogate mother is the carrier of the baby.
yes. What are you know that there are children that are born with let's say autism down the spectrum. Would the carrier's medical history play a part in the genetics of the child?
No.
No.
So when a woman is pregnant for a child, the surrogate mother in this instance is a gestational mother. It means it's just carrying the baby. That baby was formed from another sperm and another woman's egg, not directly to her.
Yeah.
So you are transferring a formed baby in the earliest phase of an embryo into the woman's womb. Now, any genetic expression of disease is from the genetic owner of the spermatozoon, and the egg.
Okay.
Autism is a genetic expression, so it will not be expressed. However, if there are viral blood transmissible diseases, there can be an infection of that baby depending on the mode of delivery. But where there is if the woman is HIV positive, I mean the surrogate mother, the carrier, there can be a mix of blood. So blood transmissible infections can be transmitted to the baby.
Okay.
Genetic expression diseases like autism, Down syndrome, epilepsy, any genetic disease from, let's say, diabetes, hypertension, and all that can be expressed from the owners of the spermatozoon and the egg. But blood transmissible infections can be transmitted to the baby from the carrier of the baby. I don't know if this is clear.
Yeah, that makes a lot of
Let me
sense.
understand when you say the egg, how do they do it? Like, is it that they inject the surrogate mother, or how do they carry the egg and the sperm and put it in her body?
Okay, so it is a bit beyond the scope of our discussion, but I will try and explain it in the most lay terms that everybody can understand. So what happens is that I would say that the donor A and B, is the couple forming the baby. So donor A is the man who donates a sperm. The sperm is looked at and sampled out in the lab. We get the best of spermatozoa that has good motility and structure, and it's kept. The woman, we give a lot of injections around the time because we need to harvest the egg. We give some injections like gonadotropins. I'm trying to use the chemical name because we don't mention drugs in podcasts. So some drugs are given to help the woman's egg to mature. We actually want many eggs. So we want many follicles that house the eggs to mature. And we harvest the egg from the woman. We do that through the guide of an ultrasound scan going through the private part of the woman to assess and all that. So technical things, we harvest the egg. Now, the woman's egg and the man's sperm is cross-matched in a test tube. That is why it is in vitro fertilization. In vitro means outside. In vivo means inside. So in vitro fertilization means you are getting a sperm from donor A and you are getting egg from donor B, being the female partner, and a baby is formed, being the zygote. By third day, that zygote becomes an embryo, and it is now transferred into the surrogate. The surrogate mother is now prepared like a woman that is trying to get pregnant, still with some hormonal injection, and she receives the baby, and the baby starts growing in the womb. But luckily now is that there are now findings that we can create an artificial medium of a womb. So in the next few years, it will become a global thing that a woman who wants to maintain her shape can actually approach a fertility vendor. And she brings her egg, the husband brings the sperm, and it's incubated in something that looks like the womb. It has the amniotic fluid. Everything is created to mimic the womb. And the baby is housed through and becomes a full baby. And after 40 weeks, the baby is carried. So that's where the world is going to. And I think the Gen Zs will enjoy it more.
Yeah. That's really good to know.
Yeah, that's where
So
we're
that
headed.
brings us to the point where we say technology is at the same time a savior and a doom.
Yeah.
Okay, this one not sweet you, but marrying plenty wives sweet you.
I just wish men can carry babies.
I bet that
If they can, we'll have less
we
babies.
that kind of thing.
It's more difficult to carry a baby and raise a child than making money. Yeah, I was interacting with a female doctor, and I was a younger colleague. I think she's just 2 years post-graduation. She's going to UK soon. And I asked her, your journey of pregnancy, if you were to get more calls, like to work in the hospital, she does 10 days on and 20 days off. So I just threw a question at her. I said, what if you had to work 24 days on and 6 days off and the pregnancy, which would you pick? And she actually said that being on call would be better than carrying a baby. Pregnancy messes up a woman's psyche. There are women that after pregnancy, they start forgetting things. And they never recover fully their retentive memory after that. There are women that it destroys thank God for BBL, where people can get back their snatch back, but can snatch back their body from. But there are women that if they are not inclined to that, they may lose that figure 8 that you saw when you were chasing them. There are women that have run mad, what we call postpartum depression, from poor social support from their partners. There are women that have lost their lives. In fact, I lost my grandmother, my father's mother, So the story has it before I was born, she died giving birth to twin boys. And it was because then it was a taboo to give birth to twin boys. My grandmother had survived to give birth to twin girls, and the village king had come and warn. My grandfather was a village warrior. He was very tall and was a troublemaker. So the village king was also afraid. But he was going to be the first to give birth to twin boys. And he had a personal beef with the village king, and they had to come and warn him that they were born down. And then the women that deliver children, the traditional birth attendants, came and told him that this one is twin. Oh. And I think around that time there was a joint hospital, President Joint Hospital in my villa, and they found out that it's a male through scan and all that. And he was so afraid that they had to go and induce termination of pregnancy, and the woman bled to death.
Oh my God.
So imagine if it was now, I would have had at least 2 uncles, as my father is no more. So a lot of things that medicine have helped us, including surrogacy, we should encourage it, and more importantly, encourage our women.
Yeah, so
And support them
on
when
the
they are
back
pregnant.
of that, how would you advise that we sensitize people about surrogacy?
So first of all, there should be a legal framework for it. So if the National Assembly ever hears this, we should have consultants in Obs and Gynae, the Society of Obstetrics and Gynecology of Nigeria, advise the federal government on the benefits of surrogacy. It is instructive to note that surrogacy should be done on medical grounds. Women should not, because they want to keep a body, they want to go and do it. Of course, Nigeria will get to that, but do they have the resources? Do we have enough facilities to cater for aesthetic needs of surrogacy? That's what I'm saying. But if there are medical indications where the woman cannot carry the baby, where the woman cannot carry the baby to term, where there's a recurrent history of miscarriage, where there are disease conditions, autoimmune disease of the woman that will make her reject the sperm of her partner, those kind of situations, or her body cannot withstand pregnancy, or she has a medical condition, maybe a major surgery around the womb that have compromised the state of the womb, or even the tubes are blocked, and there's no way that the egg from the ovaries may be able to fertilize the sperm that is coming. Those are all the conditions that the woman cannot house a baby in that womb. Or there is a huge fibroid that the woman is still fighting off, not to remove. Maybe has a health condition, a bleeding disorder that if it goes under the knife, may not make it. These are all conditions that can make a woman to seek a surrogate. So if we have a legal framework for it, then it's something that we can talk more about. But for now, there is neither here or there. It is not explicitly illegal in Nigeria. But we know that it is because we don't have a legal framework. Once we have a legal framework, it makes it either legal or not. But I would rather that the government says have a legal framework for medical indications of surrogacy. I think that is what is tenable globally.
Okay, so I want to ask, we're in Nigeria. And Nigeria, we are very religious people. We have different religions. We have Christianity, we have Islam, we have the traditional religions and other religions. So, how accepted is this surrogacy in Nigerian religions? Let me just say Islam now. They'll tell you there are some things that they don't accept. In Christianity, they'll tell you there are some things they don't accept. So, because this surrogacy thing is a new thing, it's still coming up in Nigeria. Our religious system, have they fully accepted it, or something they found out?
Okay, let me remind you, I'm a doctor and I'm not a pastor. So we are not trained to be judgmental. We only do things that are ethical in medicine. However, I think gestational surrogacy is something I think Christians, of which I'm a Christian, may accept, because there is no pain, there is no adultery, there is no man going to have intercourse with a woman to have a baby. the baby is formed in the test tube. Is formed through IVF because the same legal couple, the man, donor A, like I earlier mentioned, donates a sperm. Donor B, the woman, donates her egg, forms a baby, and the baby is now transferred into the surrogate mother. So there is nothing immoral about it from the point of view. But I don't know whether there are Bible verses that is against surrogacy. I'm not sure. But this may be in the confines of a religious meeting where you bring in an imam, you bring in a pastor, you bring in an atheist, you bring in a traditionalist, and they go all out and discuss it. That way we can know whether there is a religious outlook to it. But for us, it is that a couple approaches us, they're having this difficulty with having a baby. And we have assessed the woman, and the woman has medical indications that she cannot carry a baby to term. And there is now an option that there can be a baby carrier. And still the same couple with their egg and the sperm have a baby and somebody carries it. In clear terms, that's what surrogacy is all about.
So can a surrogate mother decide not to continue with birthing the baby after maybe sometime, maybe either due to medical or maybe her body is not just okay, or maybe emotional?
Prior to accepting the surrogacy, there would have been a comprehensive gynecological and reproductive health screening. So there is no, it's not a guesswork. In medicine, it's fact-based engagement. So we would have had a conviction, including doing a pelvic proportion test and everything biophysical test for the woman, all genetics, reproductive health screening to know that she can carry baby to term. And remember that in our practice at Smart Health Life Care Group, there must be a legal agreement between the couple that wants a surrogate and the surrogate mother. So whatever is in that agreement, they will keep doing with their agency and the lawyer. Our own is to focus on the job.
What if regardless of the agreement, the surrogate mother say,
the lawyer, the surrogate agency, they go into their legal, they go to the courts.
And what if
For us, our job ends when we transfer that baby and we encourage them to register in antenatal.
So what if it's something medical that actually happened to the woman and she's not able to
continue? Oh, now you're asking. So if there are things unplanned that happen and the woman is not able to carry the baby, of course, we are going to terminate the pregnancy, but it means that there is a justification. And let me just mention the things that could happen. If there is antepartum hemorrhage, like if the woman starts bleeding heavily before delivery, is an indication to terminate the pregnancy because you don't want her to bleed to death. If there is release of amniotic fluid, right? If there's release of amniotic fluid to the point that there is no longer amniotic fluid where the baby can swim, the baby needs to come out. Do you understand? Maybe early enough and it's kept in an incubator. If there is a gunshot injury and the woman, you have to bring out that baby and control the baby so the woman does not. So these are rare instances, but most of the people we bring in for surrogacy are those that are within the ages, young women that you know that they are in the peak of their health, between 21 and 27. Nobody goes to look for a 35-year-old woman to come and do surrogacy. Because by then, the woman is already coming down in health. Do you understand? So it's mostly young women who we encourage to be surrogate mothers. And remember, before a woman becomes a surrogate mother, they actually do a pre-reception consult. I mean, before she received that baby. So she's told of everything about surrogacy. She understands what she's going. She signs a consent form for both the medical facility. So she's now going to see the lawyer with informed consent. It means that she knows what she's going into before going to the lawyer. So there's a consultation that comes in with the surrogate prospect, the surrogate mother prospect. So she comes in and we tell her everything, including all the tests she would have done, before we can now say she's eligible to become a surrogate mother. So there is an eligibility criteria for a woman to be a surrogate mother. So these are all things that both the agency, the doctors, the lawyers would handle before they now commit to the surrogate journey.
Wow.
Yeah. Now wow. Truly now wow.
Anyway,
All right. So
this is a topic where we never knew it's going to go this far, but I think we have to say a very big thank you for Dr. Sam, Tracy, and Luchi Green.
Sorry, can I ask one last question?
Come on, you
Yes.
can.
So, doctor, is this something that your practice offers, or you can recommend surrogacy agencies for people looking to?
yeah, so there are known surrogacy agencies known to Smart Health.
Okay.
However, we do not run surrogate agencies. But if a couple approaches us
Yeah.
and they've discussed with a suggested surrogate agency, of course, we are interested in doing an IVF
Okay.
for a couple. We are happy to see that women who are looking for children have their own baby, and it is through a legal framework. We do not do baby factory in Smart Health Life Care. We do not accept any money from surrogates. We do not outsource surrogates, but we know of surrogate agencies that we can suggest to couples, or they come with their own surrogate. They look for a lawyer. We will confirm that the lawyer is registered with Nigerian Bar Association. And we look at the contract, the agreement, and be sure that our fertility facility is not going to be in a legal battle in any way, because what we are providing is fertility assistance to the couple. Do you understand? So we offer IVF service. We offer IUI, men that cannot produce sperm. They will get a donor and they have their baby.
Okay.
We offer gender selection, even though it's a very topical issue. We offer gender selection for couples, and we offer, and it is instructive for me to say on this platform that I am the team lead and the lead partner for this service. There are registered consultants with Medical and Dental Council of Nigeria, with NMA, that work with me, from senior registrars to consultants to senior consultants, including a laparoscopic surgeon. They are all in the team of the reproductive health. So whenever the job of the team lead is to make a diagnosis, start up the discussion, have a consultation, which could now be multidisciplinary, where we invite the consultants either remotely through a Google Meet, through our website, www.smarthealthlifecare.com. They book through that platform, or they come to our physical locations, either in Laje here, Healthland opposite Ikota Shopping Complex, or Grandview Medical Group. Smart Health has a legal partnership agreement with them, or Occupational Health Prime in Lekki Phase 1, or Origin Fertility in Ikoyi, which is our IVF facility. And even in Origin, we have an agreement with them, with a reputable fertility specialist that work with Smart Health to render service there. So we are eager to help couples, but we do not offer surrogacy agency. But we know of reputable surrogate agencies that couples can approach. Once they finalize and they have an agreement, our job is to do IVF and make sure that the woman is carrying a healthy baby.
So aside your website, are you on any social media platform?
Yes, on Instagram is smarthealth_dr_dr. On Facebook, we are starting Smart Health Life Care Group as a page soon, but the lead partner is on Facebook, which is Sam Obo, SAMOGBOO, Sam Obo. On LinkedIn, Samuel Obo. On YouTube, we are starting a YouTube very soon, and it's going to be Smart Health Life Care Group. and all. So that's about it. But we are very active on our website. We are active. We run 24/7 response service on our WhatsApp. And on our website, you can actually chat us directly. You can contact us on WhatsApp through the website. And the reason is that there are people that they are not on any social media handle. So once they visit the website, anywhere in the world, they can reach out to us. But we are going to create a very strong visibility on Instagram and YouTube in this next 1 year. We've gotten a content creating team that will be set out in June, July. So it's a good thing I'm coming here to talk about this, and I want to thank my brother, our host, Bright. He's been my friend. He's been my friend, and he's a resourceful guy. Well done.
Thank you.
Thank you.
All right.
Thank you very much.
Luchi, I need you to close this.
Oh, well, thank you very much, everybody. Today's episode was a very interesting, educative, and very deep conversation we had. I didn't even really know a lot of things about surrogacy and all, though I've been hearing about it. But from what Dr. Sam has been able to dissect, I can really understand, and I can also go out and share the information that I've heard. So thank you very much. And this is my closing. Thank you all for watching.
Yeah, please like, comment, share. Please share to your friends, repost, like, subscribe, so we can have more views and sponsors. Thank you.
All right. From my own end, please don't stigmatize people that approach any form of legal assisted reproductive technology. The truth is that it is only in Nigeria or in countries where people always want to talk down on people that they will stigmatize to say, oh, that baby came in through IVF. It's a normal baby. It is the same thing that had happened in a woman's womb that is happening in that test tube. A sperm is meeting an egg and the baby is being formed. And for a surrogate, the woman is not able to house it because of a medical condition. And another woman is housing that baby and will be transferred back to the couple after the journey of surrogate pregnancy. So let's not stigmatize. If a woman even has a CS, you should not stigmatize to say, oh, you're not born through normal route. At the end of the day, there is no stamp written on a child's forehead, CS or vaginal delivery. So let's make the world a safer place for couples and encourage them to have their baby so that they can live a happy life and will have a happier home across board. Thank you.
Thank you.
Yes, it's been an amazing conversation today, and I want to thank everybody. And this face, Tracy, you've been seeing it regularly, and Dr. Sam has been our guest one time before, and now he came back. And I so thank him for coming to dissect this topic today. And Luchi Green is the one that's always been here. And she's a Thank you for watching, and I promise you we would always be bringing interesting topics your way, and watch out for more.
All right. Thank you. Thank you.
It's the Out Loud podcast show.